Good morning. I'm Councilmember Vincent C. Gray. All right, we'll start on my left and your right.
Good morning, Chairman Gray and members of the committee. I am Alma Gates, an ANC Commissioner and resident of Northwest Washington. While not in my single-member district, Grand Oaks Assisted Living at Sibley Hospital falls within the boundaries of ANC 3D, and it was through the ANC that I came to know the person I represent on the Grand Oaks Oasis Resident and Family Council. I am so pleased to be here, a year after my initial testimony on the topic of assisted living, to thank you, your fellow council members, and the chair for unanimously supporting Bill 220689, the Omnibus Assisted Living Residence Improvement Bill and Quality Long-Term Care Act of 2018. Passage of this legislation is badly needed now. Thanks also to your staff. My personal experience as a friend of a Grand Oaks resident has been painful and one that makes aging in place an easy choice. Not much has changed at Grand Oaks over the past year, and I especially draw your attention to the testimony of Ann Hewer and Stephanie Ross, who point out in more detail that residents' requests continue to be greeted with hostility or stonewalled to ensure profits from the assisted living facility go towards offsetting Sibley's operating shortfalls. I really hesitate to use the term senior abuse, but what I've seen and heard has that smell. If others weren't so afraid of retaliation by management, they might be here testifying. But every month, I see a large gathering of residents at the Resident and Family Council meetings who speak freely about problems because management is not present. A concern I raised with management at a family council meeting is what is being done for the mental health of residents. Is there a licensed clinical social worker on staff? The response was no, we have a chaplain on staff, and residents can ask to see a social worker. But the chaplain who provided 4 hours a week of emotional support is no longer available. Mr. Chairman, swift passage of the bill is critical to ensure that residents of assisted living facilities are adequately protected and that their physical and mental needs are being met. Currently, there are too many cracks through which residents' rights and needs can fall. And this is what is happening at Grand Oaks, the city's premier and most expensive assisted living facility. I am hopeful the bill will become law before the end of the current council session and that improvements to assisted living residents' quality of life issues will immediately follow. If I can provide any assistance, please feel free to call on me. Thank you.
Thank you very much, Ms. Gates.